introducing our speaker. So I think what we'll do is go ahead and get started with the webinar, and I will introduce Tina Cardarelli. So, Tina began working in the breastfeeding field over 25 years ago, first with the Massachusetts WIC program and then the Michigan WIC program as a program coordinator and breastfeeding coordinator. She has provided private consultation on breastfeeding to the Michigan State Health Department and many others. Tina's current position is Director of Breastfeeding Services at Indiana Perinatal Network, home of the Indiana Breastfeeding Coalition. Some of Tina's relevant breastfeeding initiatives include a breastfeeding newsletter with 1,500 subscribers, which includes a strong mPINC quality improvement thread, and co-facilitating the Link Hospital Learning Collaborative, a group of 8 Indiana hospitals working together to achieve baby-friendly designation. Tina has a long fascination with the efficiency and usefulness of mPINC as a quality improvement tool. In 2014, she was invited by the CDC to sit on an 11-person mPINC expert advisor panel and is a member of a national hospital breastfeeding quality improvement task force. Tina is a much requested national and local breastfeeding speaker and educator. Tina was recognized this past fall as one of 8 women who received the Torchbearer Award, which is the state of Indiana's most prestigious recognition of women. Indiana Torchbearers are those women who have been pioneers throughout their lives and careers in breaking down barriers that exist for women. In addition, Tina also received the 2016 Keeper of Light Award, which is given to one woman each year in Indiana that is an unsung heroine who has quietly and persistently worked to better her community for women. Only 20 women have ever received this award in Indiana history. And now let's have Tina begin on her mPINC results talk.
Good afternoon, everyone. I hope everyone is hearing me. Can you hear me? Can everyone?
Yeah, we can hear you. We can hear you.
Hear me?
Yep, we can hear you.
Okay. Okay, thank you. So thank you. My talk today is called Survey Says mPINC Results, and people who know me know that, don't get me started talking about mPINC because I just love it so much. I'm such a fan of mPINC. I like to call it the CDC gift that keeps on giving. And so for those of you some will be familiar on the call with mPINC and some not so much, just for a little introduction, the CDC, mPINC stands for Maternity Practices and Infant Nutrition Care. My slides are not moving. I'm sorry, my slides are not moving. Please hold on, everyone. Okay, thank you. So welcome to the 2017 Breastfeeding Webinar Series. And it is brought to you by, as you know, Indiana Perinatal Network and the Indiana Breastfeeding Coalition. We want to thank our sponsors today. We're particularly thankful to the Michigan Department of Health and Human Services and to the Indiana WIC program and to St. Vincent's Health. We're very happy this year for a new partnership with people from Michigan and welcome our friends from Michigan on the call. Next slide. To talk to you today about continuing education units, 1 hour of SERP has been applied for lactation professionals. And a certificate will be emailed to everyone registered today for the call, and you will receive that within 10 business days. Also, this call is archived so that you can listen to it or send your coworkers, friends, and associates to it at a later date. So these are the objectives for the call today. We're going to step back a little bit and look at a little history and perspective. We're going to really look at the trends since 2007, and this is very important. So this year is kind of a landmark year because mPINC is 10 years old. It was started in 2007, and it being 2017, it was funded for 10 years, 5 surveys over 10 years. And so we now are in this position to look back and really look at the trends in the work that we've done over the last 10 years. So that's kind of exciting. In the next rendition of mPINC, called mPINC 2.0, that's been funded for the next 10 years, the questions will be a little different on the survey, and so we will not see the trends again because we'd be comparing apples and oranges. So this is a very good time to get a perspective on where we've been and where we're going. Those of you familiar with mPINC know that it's broken down into 7 dimensions of care, and within those 7 dimensions of care, there are 39 indicators or practices. We're going to look today closely at each dimension of care and briefly review some of the key indicators where I see that there's opportunity for a lot of growth. We're going to talk a little bit about QI strategies, but what I'd really like you to do in the questions section is, if you have answers, because I don't have all the answers. I have a lot of questions. I don't always have all the answers, but if you have answers to my questions of like what you're doing to fix that indicator, please feel free to type it into the box. That way we'll learn from each other. We will touch on some resources, and if you're not using the resources out there to help you with mPINC, I want to tell you there are a lot of resources, even on YouTube. I've spent the last couple weeks really searching around YouTube, and there's a lot on there. There's a lot of information from other states. And hopefully at the end of this call, you will be inspired to action in a way that you have not been before. So that's the key goal. Next slide. My slides are not advancing. Yikes. I'm sorry, be patient with me. I don't know why my slides are not advancing. Here we go. So to start off with a little history, I'd like to show you a video. It would be nice to just get a little overview of how mPINC came to be and in the last 10 years. And so I want to tell you that I was invited this past year by the CDC as the person outside of the CDC to work on a video project that we would really tell the story of this mPINC and what it means to hospitals and why it matters. And the reason they wanted my perspective is because I talked to so many people in the hospitals, and they just really wanted to know what goes on when like mPINC is filled out, and what goes on when it comes in the door, and who's seeing mPINC, and they just had like a million questions. And so I don't know if you've seen this before, but there's a video that's now up on YouTube, and it's really meant for people in the hospital and administrators. And if you can pull this video up after this webinar, and you can show it to people in your hospital, you can show it to your administrators. It will help you get buy-in for mPINC. And so we're going to show you this short 4-minute video that I'm very proud to have worked on. I'm sorry. I needed to go to Marquette to play it, and for some reason it's not playing. We might have to skip it, and we'll come back to it later. All right, so let's talk.
Difference in whether and how long a mother breastfeeds her baby. I urge each of you to promote and support breastfeeding for every new mother who is able to.
Use your CDC Maternity Practices and Infant Nutrition and Care benchmark report to improve breastfeeding support for mothers and babies in your care. The mPINC quality improvement process started in the early 2000s when CDC met with a panel of experts and hospital administrators. They recommended that improvements in maternity care practices be assessed and monitored over time in all U.S. birth hospitals. CDC administered the first mPINC survey in 2007 and has continued the survey about every 2 years since. We analyze the data and produce individual facility mPINC benchmark reports to provide points of reference for evaluating change in performance in maternity care practices that support breastfeeding. The reports are free to participating U.S. birth hospitals. They're organized to help you understand how your hospital performs across 7 domains of maternity care that support breastfeeding. This reflects care that begins prenatally and continues through hospital discharge. It provides a logical framework for integrating evidence-based maternity care practices that support breastfeeding in hospital policies and daily routines. Each domain is scored and averaged to provide a total score. You'll see how well your birth hospital compares to other birth hospitals in the U.S., in your state, and to those of similar size. In addition to improving birth hospital performance, mPINC benchmark reports have driven nationwide improvements in maternity care. Some birth hospitals use the mPINC process to move towards achieving the baby-friendly designation, a distinguished standard of excellence in maternity care that supports breastfeeding. Over 80% of U.S. birth hospitals participate in mPINC. Be an mPINC champion. Bring together your maternity care team to review your mPINC benchmark report. Include obstetricians, anesthesiologists, pediatricians, maternity care staff, nurse managers for mother-baby care, administrative leaders, quality improvement officers, lactation specialists, and others. Identify and take action on priority areas to improve your birth hospital's performance. If you want to go fast, go alone. If you want to go far, go together.
Okay, so very proud to work on that. Some of the things I learned from the hospitals I've been working with for over the years is years ago I saw when the mPINC survey came, the lactation person filled it out. Pretty much it was the best kept secret, sent it back in, got the results, sat on her desk back in the years when it was a paper copy. And so what we worked with a lot with hospitals was assembling a team and really filling out the survey together. So there's a lot of learning and then receiving it together and then making plans for QI. And I was really happy to see that in the video. So that's what the hospitals that, you know, the perspective we were able to give them. And also to the idea that mPINC is a beautiful vehicle to ride all the way up to the front door of Baby Friendly. And I loved the way they did the road there and basically showed how just focus on mPINC. It's just a wonderful, wonderful tool. In fact, in all that years that I've worked in breastfeeding, I really think this is my absolute favorite favorite tool. And so if you haven't been a big fan of it, I hope this will reignite your interest in it. So mPINC is a CDC national survey of maternity care practices and infant nutrition care. I told you it's been around for about 10 years, and it's measuring infant feeding care practices, policies, and your staffing expectations that are in place in your hospital that provide maternity services. Who's included in the mPINC survey? Well, any hospital or birthing center. And it's a biannual survey, and the surveys are administered on the odd year and received on the even year. And one of the things that I wanted to tell you is that it blows all other surveys out of the water in terms of participation. And so it's unheard of in the national world of public health that you would send a survey out, and nationally, as you can see in the right corner, 89% of national hospitals and birthing centers responded to the mPINC, and I understand that that is just, you know, at most you can expect 50 or 60 from an average survey at best. I'd like to show, and for people who are on this call from outside of Indiana, please bear with me. I am using Indiana data, but I've looked at some other states, particularly Michigan, and see that our data is very close. And so if you have your own data available, please refer to it. I tried to do multiple state data, but it was too confusing, and so we'll stick with Indiana data. Indulge me while I celebrate a few things from Indiana, and one is that we had a 97% response rate in Indiana, which actually means only one hospital in our state did not participate. We have been the state with the highest survey response for the last 4 mPINCs, and I believe that's because of the awareness that we have been raising in our state. And I think any state is possible. It's possible for them to have a 96.7% response rate as well. You just need to get the word out there in multiple ways. So let's start to look at the results. And this is what every hospital that fills out the survey gets the survey results, but every state gets a composite of all of their hospitals' responses. And you can find those online, and I'll direct you to those later, those results later, if you have not already found them. But what I want to show you here is we were talking about looking at trending since 2007, and one of the things it shows you right on the front of the composite is the trending since 2007. And so you can see that Indiana started at a 62, and I remember I came to Indiana in 2008, and people said, oh, that mPINC result's pretty good, 62, you know, that's pretty good. And I started my career as a classroom teacher, and I'm like, and what book is a 62 really well? Because you wouldn't want to see that on your child's report card coming home. So that was just a different perspective. Is like, that's a low D bordering on an F. And then we started to hit mPINC really hard. We had an annual hospital summit where it was a priority area. I talked about it in my newsletter. We had regional webinars. Just a lot of work with hospitals, and we were below the national average, and now we're above the national average, and this year we received an 80. And this is how that looks, graphed it out, and so you can see it's nicely moving up. These slides actually came from a recent CDC mPINC webinar. They think is going to be repeated tomorrow by USBC. That's very good, and I'll direct you to register for that, and I'll give you information about that later in the call. So what I want to look at down here is that the states have ranged between a 60 and a 96. So the states in a 60 are white, and the darker the states get, the better. And you can see that the national average is 79. What I put on the 63 or 79 is the trending. So in 2007, the national mPINC score is a 63, and now it's a 79. And something to celebrate for Indiana is we were ranked 24th, and now we're 22nd, which is a big, huge deal because all the states are improving so quickly that it's very hard to move up in the ranking. I do want to point out that that's 22 out of 53 composite scores. And the reason there are 53 is because they've included island territories, Puerto Rico, and Washington, D.C., in addition to the 50 states. I want to look at labor and delivery care, and that is the first dimension of care. And you can see that great things have happened under labor and delivery care. I think that everybody should give themselves a pat on the back. And so the states currently range from a 65 to a 98. So I will repeat that, a 98. So there's some amazing work being done in labor and delivery care. So the national average went from a 59 in 2007 to an 85. And you can see, excuse me, I can't, you can see that our score in Indiana is an 88, so we're 3 points above the national average. What I want to show you here is this looks at initial skin-to-skin contact at is at least 30 minutes in the first hour for a vaginal birth, is at least 30 minutes in the first 2 hours for a cesarean birth. These are all very respectable, and they have gone up astronomically for most states over the last 10 years. What I want to show you is that what's concerning to me is that the initial breastfeeding opportunity within the first hour is at 72%. So somewhere between 20% of those women that are getting that initial skin-to-skin contact, it seems to me as though the baby isn't being left on long enough to actually initiate breastfeeding. So that's a place where I think a lot of improvement could be made. And I think we're doing very well with the breastfeeding after cesarean section, because you can see that numbers very close to the amount of women that are having skin-to-skin contact after a cesarean. Now I want to look at the next dimension of care, and that's feeding of breastfed infants. And that range is from a 68 to a 97, again, really high scores. And the progression has been since 2007 from a 76 in 2007 on a national level to an 87. And so in terms of Indiana, we are at the national average at 87. And I want to look at the indicators that are within this dimension of care. So infant feeding is breast milk after vaginal birth, 85%. Looking at it, the progression, it's gone up. A lot of work being done in this area. After cesarean section, very respectable numbers. What we're really going to be focusing on a little bit is supplemental feedings to breastfeeding infants are rare. 24%. So only 24% of our hospitals in Indiana, and pretty much looking at other states over the weekend, this is pretty much the case. This number isn't moving a lot. We've made great headway with not using water or glucose water. Look at that, 91%. I want to show you what the appropriate feedings look like in the trending. And you can see that we started out with 23% in 2007. And look, that's just a flatline number. To show you what that looks like graphed out, it's pretty flatline. So a lot of work needs to be done in this area. And I look to people to tell me what that work is. But I know these are the kinds of things that I've heard, is that we need to make sure that with supplemental feedings that information is available in charts, or it's available electronically, so we're able to put in why these feedings are occurring, and then we're able to extrapolate that data. I've heard that people say that we need to initiate chart audits to find out why we have really not moved the dial, that this requires more focus and better prenatal education. It needs to be a focus of our prenatal education. It needs to be a focus of our staff education. So this may be a thing that next year you talk about this primarily in staff meetings and be more strategic. So I really feel that this is, look at what to go back, look at what the score would have been if we could have moved the dial on this particularly stubborn area. Looking at breastfeeding assistance, and we'll go a little bit more into what that includes, we can see here that the range is between 80 to 100. So there are some people that are getting this score on this, and the national average has gone in 2007 from a 79 to a national average of 89, and ours is just 1 point above the national average at 90. So looking at breastfeeding assistance, it's looking at documentation in the patient's charts, and we would anticipate that 100% of our hospitals are documenting the infant decision, the infant feeding decision. So yes, that's happening. Staff is providing advice and instruction. I don't understand why that's not 100%, but so there's a little work to be done there. Staff teaches breastfeeding cues to patients, and that is very high at 96%, so great job. I will be looking a little bit at staff teaches patients not to limit suckling time. So we'll go back to that. Staff directly observe and assess breastfeeding. Awesome job, 97%. Staff uses standard feeding assessment tools. This is great. I was on a CDC call. I think the one they'll be repeating tomorrow at USBC talked in detail about feeding assessment tools. It really provides pacifiers to breastfeeding infants, and look at that at 41%. So you can imagine what the score would have been if we could get a handle on the pacifier use in our hospitals. So a little bit about that. We've seen hospitals make a lot of strides with just getting a grip on how pacifiers are used, and many of our hospitals lock them up in the Pyxis. Some of our hospitals have actually put an even bigger barrier between the patients and the pacifiers, in that they put them in, as an intermediate step, they've put them in their gift shop, so that if a family wants them, they can actually go down and buy them. But it's taking more of the judgment away from the nurse that she's being pressured to give the pacifier. It's like, well, they do sell them in the gift shop, but we don't give them, only for procedures. And then again, you'll see later in the call, when we talk about staff training, a lot of this is going to fix itself when we make more headway with training our staff. And so you may make this a focus of the education that you're going to be giving your staff this year, and maybe look at your hospital scores, look at your state scores, and see if this is as problematic as it is in this state in your hospital, and what kinds of things you can do. And I'd love to learn from you to limit that so that patients get off to the best start with breastfeeding. One of the reasons I'm going back to patients, teaching patients not to limit suckling time is I work as a co-facilitator with 8 hospitals worldwide, and we talk a lot about that word time. The word time when it comes to the length of a feed, and the word time when you're talking about the distance between feeds. And that we have to do some scripting with nurses and just some rephrasing and looking at this so that people get comfortable with taking that word time out or assessing time. So that's pretty much the big thing there to be thinking about. Let's look at mother-infant contact and look at the range is between 62 and 96. So that's quite a range. So we have 2 states here below 70. We know one for sure is a 62. And then we have, you know, states that are in the 80s. And of course, you want to zero in on your own state there and see how you're doing. But the trending since 2007, this dimension has improved from a 67 to an 83. And we are below the national average. It's the only one we're below the national average in. And so let's talk a little bit about keeping our families together. And so this dimension of care looks at these 5 different practices or indicators. Are the mother-infant pairs not separated during postpartum transition? 81%. Mother-infant pairs remain at night, 85%. That's very encouraging. Mother-infant pairs not separated during the hospital stay, 39%. What I want to point out to you is these are hospitals that gave the ideal response. So it actually isn't as bad as it looks, and we'll dig into this a little bit. But what really is concerning is this one here. Infant procedures assessment care are in the patient's room, so 10%. So we have not done a good job in our hospitals of moving that procedure into the patient's room. And what we need to talk about a little bit is, are your scales portable? Are your nurses comfortable with giving baths in front of the moms in the room, or are they still relying on going back to the nursery if in fact you do have a nursery? Many hospitals in our state have gotten rid of their nurseries or turned them into procedure rooms. Is the lighting what it needs to be? Those kinds of things. And so I think that it requires a very hard look to really know, why isn't this happening? And really, I'd like you to look at your individual hospital scores or your state scores and see how it lines up. So this is just one example using the Indiana scores. And then I like this last one, non-rooming in infants or brought to mothers for night feeds, 95%. And so I do have to pose the question, does your hospital still retain its nursery? Because that's problematic when you're trying to raise the procedures and you're to raise the mothers and the infants not being separated. And we've seen a lot of different creative ways of keeping babies in the with their families and not having alternative places where the babies could go. And that's, we don't have time to discuss that on this call, but I'd be interested in hearing what other people, what other hospitals are doing. So mother-infant pairs are not separated during the hospital stay. I just wanted to show you a different look at it to see we're making great headway here. That line is almost going straight up between 2013. So I think a lot of work has been done. We've had a lot of conversation around this issue. What you can see when we look at the dimensions of care and all the indicators, we're not going to look at every single indicator. We're going to know that some of them we're doing really well in, and some of them really need to be focused on. And that's what I'm hoping you do, is really sit down with your scores with a critical eye, whether you're state leadership or whether you're looking from your hospital, and really pull out the places where you can make a big difference in your patient care, thereby making a big difference in your mPINC score. And so I want to show you what one of the questions looks like that's assessing if the babies are staying with their mothers and if procedures are happening in the rooms. And so it's asking approximately how many healthy full breastfed infants are taken from the room for these following procedures, like pediatric rounds, change of shift, visiting hours, hearing tests, heel sticks, infant photos, bath. And so what you have to understand is that when we're looking at the results, they're an ideal response. And so so that percentage is only measuring the people that said, yes, hardly any baby, this one I have circled here, few babies leave the room during those specific kinds of activities. And what you want to avoid, because I think a lot of this actually, as a result of not taking the kind of care to really fill out the survey with great detail and care and get the information before you fill it out, because you certainly would not want to check off not sure. You definitely would want to get your answers, because checking off not sure is lowering your score. And, you know, I was a teacher in my early years, and I'm not saying to teach a test. That's a conversation you hear a lot in education. I'm not saying that. This is a tool for your own use, but what I am saying is you're shooting yourself in the foot if you're not answering these questions. And so then the other question at the bottom, I'm not showing the detail on it, but they're asking for an average of how long each baby's, a healthy full-term infant is staying in their mother's room. And this just isn't breastfeeding infants, this is all infants. And they're having you do it by hours. So 0 1 hour and 2 to 3 hours. And so that's an area where you can really focus down on. Next dimension of care is discharge care. So what, like I like to call this, what happens when they walk out your front door? And what responsibility do you have to your patients when they walk out the door? And so you can see that these scores are all over, and they range from a 36 to a 98. And so, wow. And the white is a low score, and you can see that most of the country's in the white. Thank goodness Indiana and Michigan, I know there's people from other states on the call, we're in the very respectable 70 to 79%. The national average on this is 69, and the trending since 2007, it hasn't gone up a whole lot, is 40 to 69. And I think it hasn't gone up a whole lot because this has a lot to do with collaboration, partnership, awareness, what's going on in your community. And we're asking a lot of you. We're asking you to be spot on with your care in the hospital, but we're also asking you to, in a sense, be responsible for what happens to that patient after you leave your hospital. And that's just a lot to ask. And so there's a lot that has to happen to improve that score. So knowing that the national average is 69, you will see that the Indiana score is just 1 point above that, 70. And we're going to look here at both of the indicators under discharge care. One is that the staff provides appropriate discharge planning, and I'll give you some detail on this that I think will be very helpful. And secondly, we're going to touch a little bit on discharge packs. So just to show you the discharge protocol, like Indiana started in 2007 with 24% of our hospitals gave the appropriate answer, the ideal response to that they're given the appropriate discharge plan. We'll talk about what the ideal response is. And that's improved a little bit, not as much as I would hope, to a 38%. It's been pretty flat for the last 4 years. And so how do we improve that? How do you improve that? So what I want to show you here, look at the A33, the second question. What support does your facility routinely, most of the time, offer to breastfeeding moms at discharge? And this is what I think is happening. People say we give them our telephone number and we tell them to call us. But the reality is what the CDC is looking for here is a multifaceted plan of action. And so what they're looking at is that you're making sure that you are referring them to WIC, that you're giving them a resource sheet to what's in the community, that maybe you're calling them as well as telling them to call you. And a lot of this, I know, puts a lot of pressure onto healthcare. But I think the best way that you can maximize the care that you give to somebody once they leave your facility is to be as connected with your community as possible. So you're going to want to know what private lactation consultants are out there. You're going to want to know what mom groups are out there. You're going to want to know what other facilities in your area offer for outpatient. I know in Indiana we have programs like Well Baby at Walgreens that give breastfeeding support to moms and babies. You're going to want to know that. And so ideally to get an ideal response, they are going to put a value on face-to-face. So they are going to like it when there's a way that you can figure out how to see that person back in person. And whether that's with your drop-in centers that you have, expanding your drop-in centers, advertising your drop-in centers more, those kinds of things will all help you to move to an ideal response. I also want to look at the discharge packs of infant formula samples. And I want to tell you, I think about 9 states have pretty much made it mandatory that hospitals not give those out anymore. Our state isn't one of them. But we made great headway just by really taking this issue and sharing a lot of materials from Citizens Action Group. If you're not familiar with their materials, go on to citizensactiongroup.org and see all of their discharge bag information, the letters that can go to your hospital to ask them to discontinue this practice. And so you can see that 81% of our facilities no longer give a discharge pack containing formula sampling to breastfeeding patients. So it is measured on mPINC to breastfeeding patients. Now, that's not to say that a lot of our hospitals have just gotten rid of discharge packs. They just don't even have them in their building anymore, but mPINC is not measuring you on that. So I feel like when we talk about setting priorities for your individual facilities, or if you're calling in from a state level for your state, I feel like in Indiana, we can see the light at the end of the tunnel. And so we're going to be doing a lot of targeted things to try to get that score on the next mPINC at like 100%. And one of the things we are doing is we designed a consumer piece. It's a tinted business card that our coalition and community groups can give out to consumers. And if you saw it, you'd love this card. It takes wording from the Citizens Action Group website that talks about how discharge bags are not in the best interest of breastfeeding moms and how it will decrease their ability to reach their goals. And so the tinted card educates the mom, and then she can put it in her wallet and she can bring it to the hospital. We've had people that have done this, and if they're offered a discharge bag with formula, they can leave that on their bed, sending a message to the hospital that they don't appreciate the sampling and they understand it's not in their best interest. Or now we know that there's a lot of these sample bags in doctors' offices, and we've had requests from community groups that want these cards to leave, for women to leave at their doctor's offices. So we all know, I like to say, when consumers get involved, things happen, so we're pushing it from a different end in Indiana. And we know that when consumers get involved, red dye comes out of food and organic products start showing up, and so we're trying to tap into the clout that we know that these moms have, and hopefully this will help push the envelope. And if you want more information about this project or you want to expand it into your state, you can get in touch with me or Indiana Perinatal Network general mailbox, and we'll be happy to give you information. And so let's look at, we're getting down to the last dimensions, and let me just tell you that the first dimensions were the best dimensions, and as we get to the final dimensions, you'll see that these are the areas that need a lot of work. So this is staff training, and the range in staff training is 35 to 91. So we have states just doing horribly, and we have states doing amazingly. And I think that a lot of the states who are doing very well have a very thoughtful, organized program, or the states have bought the trainings for their states on a statewide level, which is ideal. You can see that this dimension of care, the dial hasn't moved that much, from a 51 to a 64 since 2007. We are at 66 in Indiana, so just above the national average. And what I really want to look at here when you look at that score is the first two things are killing us here. It's new staff receive appropriate breastfeeding training. And I would think that there needs to be I'm sure that hospitals have, I don't work within a hospital, I'm more of a coach from outside the hospital, but I talked to a lot of people, and just today I talked to somebody that said, that I asked, what is your protocol for a new hire? And they happen to be a baby-friendly hospital, so that new hire has to attain the recommendations for staff training for a baby-friendly hospital. But I would assume there would be some type of breastfeeding education that was required of the new staff, and that is the question you should be asking at your facility. And then, are your current staff receiving the appropriate breastfeeding education? Look, 24, 27% here, lots of margin for improvement. And I believe that that this is the most important part of my whole talk, because I believe that when we can get this number up for staff training, all the other numbers are going to go up exponentially, because we all know when we know better, we do better. So some of the things they're asking you, and this is right from the mPINC survey, is on average, how many hours do nurses spend in breastfeeding training as a new employee? And you should be asking yourself that, and you should be finding out from human resource, finding out from your department managers. If you're on the state level, you should be asking your hospitals when you are out and about and talking to people, hey, what's your policy in your hospital? So I think the more we talk about that, the more awareness we're going to raise. How often are nurses assessed for a level of competency in breastfeeding management and support? How many nurses received breastfeeding education in the past year? So it's asking you for a percentage. And so for mPINC's purposes, the ideal response is 5 hours and 3 hours for physicians. And so it's asking you how many hours did your nurses receive, your doctors, and your certified nurse midwives. And your ideal response is 5 hours for nurses and three hours for doctors and CNMs. So I told you the last two parameters were the areas that are really problematic, and structural and organizational aspects of care. So this is an area where the range goes from 60 to 97. So either states are not doing it at all, in hospitals in some states, or they're doing it beautifully. And since 2007, the score has risen from a 66 to a 77. Indiana scored a 79. And let's look in a little more detail here. So all of the scores are good. Breastfeeding policy is communicated, that your facility documents your infant feeding rates, your facility provides breastfeeding support to employees. That's a key area, though. I don't want to think in this day and age that we're doing the kind of work we're doing in breastfeeding with our patients, and there are still facilities out there that don't have an employee policy and that are not accommodating their employees. So that is a real area. If you score low in that's a fixable area. And I think with a national workplace law in Indiana, we have a workplace law as well. This number should be 100%. Facility does not receive infant formula free of charge. I'm honestly going to say that in Indiana, it probably reflects mostly our baby-friendly hospitals. But I think the pricing is that we've even seen some hospitals say it's the right thing to do, and they're looking at that. So the next thing, breastfeeding is included in prenatal patient education, 96%. I would expect it to be that high. And the facility has a designated staff member who coordinates lactation care. But what I really want to look at is breastfeeding policy includes all 10 models policy elements. And the reason I would really want to focus on that is because really people like 35% and either people, this is the trending since 2007. So in 2007, 11% of our hospitals had what the mPINC considers a complete breastfeeding policy. And we did a really cool thing. We sat and looked at all the policies and pretty much came up with the ultimate policy guideline. It's on our Indiana Perinatal Network website, and we gave it to our hospitals as a tool, and we saw a jump from like 11 to 18%. I think in that year we were working on it, went all the way up to 38%, and either people aren't filling their survey out right because we're backpedaling now, but however you look at this data, we were not really progressing. So I don't doubt that a lot of hospitals have policies, but in terms of mPINC, it doesn't serve you well to have an incomplete policy. So here's a page from the Indiana Perinatal Network website, and the link, and you can email us directly, or just say the state of Michigan if they want to look at ours. We'll send it to them and they can send it on out to you. But this is just one place you can go to get a complete policy, and then compare your hospital policy up to this one. So with that, we have covered the 7 dimensions of care. We've looked at the 39 indicators, and now let's just step back and look at the big picture and where you can go from here when you get off this webinar today. And so what's your strategy? What's your vision? And what plans of action are you going to put into place? Like, and then what are you thinking? So is this you? Are you thinking mPINC? What is mPINC? I just hate all these surveys. Just another thing to do. Or maybe you're thinking, I have no idea what to do about mPINC. Or maybe you're thinking, maybe if I don't do anything, it will magically work out. Or hopefully you're thinking, I have a plan and a strategy. I know who can help. Let's all work together as a team. And so hopefully you've moved along you've moved the dial here, so you're thinking more like this person. And what I want to say, I'll share with you is a quote from David Jakes, who said, endless conversation about change is a barrier. Actually committing to doing something and then acting is what is required. And I believe that over the years that I've loved mPINC and been involved in mPINC and talking in hospitals and community, you know, endlessly about mPINC, I've seen it move from just endless conversation to actually a commitment to action. And I hope that you're all inspired today to look at some of these things that you know you can move the dial on. So make mPINC work for you. This weekend I was looking around on YouTube, and there was a ton of mPINC resources. I was on a couple of state websites, and they had like complete, Tennessee being one of them, a complete mPINC resource. You just have to go Breastfeeding Tennessee. Amazing check sheets, all kinds of things. So have you reached out? Have you looked at that stuff? Because there's just so much available to help you and your hospital. But one of the things that we saw in the last 7 years, and I referenced it earlier, is people who are just talking about mPINC individually or filling it out individually and receiving it individually, and no movement really happens. So use your mPINC data, bring your people together, use it as a call to action, plan what areas you're going to focus on, make sure you make time to celebrate your achievements, prioritize your steps. Your survey will ask you what people you're bringing together, and you want to check as many boxes as possible. Go back to your mPINC survey that you filled out. Fill it out again. It's online. You can find it at CDC. You can find it at, just type in mPINC CDC, and it will come up. All kinds of resources. Check that out. You can scan it with your phone. You can, if you have any questions to the CDC, people in my state email them all the time. You just email mpinc@cdc.gov, and they'll answer your questions. Please use that as a resource. You go back to your state composite score. See how your hospital matches up to how other hospitals are doing. Reach out to other hospitals. Ask yourself what you can do in a day, a week, or a month. Set some goals for your next survey that will come out, your 2017 survey. What I understand from the CDC, because it is an election year and there's just a lot of change, we don't anticipate that survey will be coming out until early 2018, which gives you plenty of time to enact change. Also, to tell you, from 2 to 3:30 tomorrow, if you log on to USBC, or we can send you the link, you can register for a very good CDC mPINC tool, kind of keep this conversation going all week, by Dr. Jennifer Nelson at the CDC for more information. And to reiterate Dr. Frieden from the video you saw, if you want to go fast, go alone. If you want to go far, go together. Get your teams together and get a plan. It looks like we're running out of time. We don't have any questions that I can see, or maybe we do. We don't. We don't have any questions that I can see. So I want to end this call. Please know that you can email me any questions that you have. I'd be happy to answer them. A couple of newsworthy things is we're very proud at the Indiana Perinatal Network to be hosting Dr. Thomas Hale for a 2-day conference, and it's called Perinatal Pharmacology, the Use of Medications by Breastfeeding and Pregnant Women. We anticipate a sellout. Tickets are selling fast. You can buy them for 2 days. There's an evening, Monday, March 20th in the evening from 4:30 to 8:45, and that's high level geared to doctors, nurses, and pharmacists, although anyone can attend. And the next day is a full day. If you haven't seen Dr. Hale speak recently, his research on street drugs and marijuana is fascinating. Definitely worth a trip to Indianapolis. And I want to thank you for joining us this month and invite you back next month. And the date is Tuesday, February 21st from 1 to 2 Eastern Standard Time. And our speaker will be Lucia Jenkins, who's the Executive Director of Baby Friendly Cafe USA. And Baby Friendly Cafe USA is one of the things we were talking about when we talk about what happens when people walk out the door. Is this an answer for your community? Because this is fascinating. I've talked to Lucy many times, and she is just a dynamic, excited person about the work she's doing. So please join us next month. And thank you for joining our call, and I look forward to what you'll do moving forward with mPINC. Bye, everyone.